Okay, patients want to know what causes pain when you bend your knee. Some patients only get pain when they're bending their knee. So let's talk about the more common ones first, right? So the most common one actually has to do with your kneecap, or what's called the patella. If you have a strain or injury to the patellofemoral tendon, this may cause pain only when you bend your knee. The other is if you get a cyst that's forming in the back of your knee called the Baker's cyst, could cause pain, especially when you bend your knee. Other things that are common are just plain old arthritis. If you have osteoarthritis, sometimes the pain only comes when you bend your knee because the arthritis causes what's called a limitation in the range of motion, meaning you may lose some flexibility and you're only getting that pain when you're really kind of stretching and bending that knee. Of course, there's a very common cause after knee surgery. A lot of patients will get knee pain when bending their knee because they get all this scar tissue that forms during surgery. In any event, this could be a specific enough sign where it may guide your doctor into looking at certain things before they look at other things. Getting a proper imaging study like an MRI could be very, very helpful in a situation like this, and treatment options can be geared towards this. So pain when the knee is bent could be very useful from a diagnostic standpoint and should not be ignored for sure. And in any event, if you're going to multiple doctors and you're not getting the answers and people are still having a hard time figuring out what's going on with you, we'll be happy to see you. Just give us a call or make an appointment with one of our clinics and we will be able to give you probably more information, and specifically because this is kind of how we're approaching every patient. It's very important to kind of look at the signs and symptoms of every patient and what that patient's doing that elicits the pain. Usually that is a critical component in being able to figure out, and then more importantly, offering the right treatment option. So with that, hopefully you've gotten some information that's helpful here, and you're on your journey of improving your knee pain if this is your main issue. Take care.